Are you feeling constantly tired, gaining weight without explanation, and struggling with brain fog? You might be surprised to know that these symptoms could be linked to an underactive thyroid.
It's Doctora Victoria and George.
Today, we will discuss a common thyroid disorder, hypothyroidism. The thyroid gland is located in the middle of the neck, about here where you wear a bow tie, and it produces hormones called T3 and T4, thyroid hormone 3 and 4 respectively, and they regulate the body's metabolism among many of their roles. The pituitary gland, which is located in the brain, produces thyroid stimulating hormone, which controls the thyroid gland's function. When we screen for thyroid problems or even monitor how well therapy is going, we measure the TSH, the thyroid stimulating hormone, because it tells us how the body is responding to treatment and is the brain happy with the current levels of thyroid hormone in the body. In about 95% of cases, hypothyroidism is caused by a problem with the thyroid gland itself. While certain medications and diseases can also decrease thyroid function, it's important to note that thyroid problems are more common in females, increase with age, and are more common in white people and Mexican Americans than in African Americans. The symptoms of hypothyroidism are notorious for being nonspecific and mimicking many normal changes of aging. Symptoms generally are related to the degree of hypothyroidism. Many people with mild hypothyroidism are identified on screening tests, but have few or no symptoms that are ultimately attributed to hypothyroidism or respond to treatment. In contrast, people with moderate to severe hypothyroidism are usually symptomatic and improve significantly with thyroid hormone replacement. Symptoms of hypothyroidism can include fatigue, sluggishness, slight weight gain, intolerance of cold temperatures, dry and thick skin, coarse hair, sparse eyebrows, brittle nails, mild facial swelling, and cardiovascular, respiratory, gastrointestinal, and reproductive system problems. Think about things slowing down in the body and having some constipation issues. Women with hypothyroidism often have menstrual cycle irregularities, so those periods are all out of whack, and that can make it difficult to get pregnant, and pregnant people with hypothyroidism have an increased risk for early pregnancy loss. In severe cases, hypothyroidism can lead to myxedema coma, and this is a medical emergency. It can occur after exposure to the cold, trauma, infection, or certain medications. Symptoms of myxedema coma include decreased breathing, low blood pressure, low body temperature, and confusion or coma. Hypothyroidism is a common thyroid disorder that affects the body's metabolism. If you have any of these symptoms, make sure you can make an appointment to see your doctor for evaluation. And thank you for joining us today, our healthcare team. We hope we'll see you next time. Bye-bye.